in labour and locked in a cell. Rianna Cleary's repeated pleas for help were ignored. She gave birth alone, forced to cut the umbilical cord with her teeth.
Nothing can change the nightmare I went through or bring Aisha back, but I'm grateful that the coroner has recognised that the London Borough of Camden let me down, that the safeguarding midwife in prison was inappropriate and unprofessional, that prison healthcare let me down.
On Friday, Coroner Richard Travers described Aisha's mother as extremely vulnerable to exploitation and harm by others, including county lines, and said she had not engaged in any antenatal care. Despite Aisha's mother having a high-risk pregnancy, the court heard multiple teams failed to put a plan in place to make sure her labour was identified in time so she could be transferred to hospital. The coroner said it could have made a difference to Aisha's chances of surviving. Instead, she was discovered dead in prison. We're protecting the identity of this woman who was sent to prison 6 months pregnant. She also went into labour while locked in her cell.
My call bell was ignored. I'd been pressing it since 5:30 in the morning and nobody come and even unlocked me, and I was in active labour then. And from 5:30 in the morning, I didn't even get to the hospital till 11 a.m. So there's even that an emergency situation, I'm clearly in labour, is still taking them all that time to put that procedure in place.
Latest figures from the Ministry of Justice show 196 pregnant women were in prison in the 12 months to March this year. 44 babies were born to women in custody in the same period. This compares with 50 babies born to women serving custodial sentences in 2021 to 2022. But even if women make it to hospital to deliver their baby, the constraints of prison are ever present.
Eventually got into the back of the ambulance, was cuffed to an officer, had been told that I wouldn't be cuffed to an officer when I was in labour, and I was told that by a governor. So when I questioned the officer, she told me to be grateful that I was on long cuffs and not short cuffs.
The damning conclusions of the inquest into Aisha's death puts pressure on the government to reconsider the incarceration of pregnant women. The Prisons Minister, Damien Hines, said, "We have since made important improvements to the care received by pregnant women, including specialist mother and baby staff in every women's prison, extra welfare checks and better health and antenatal support. But any changes will come too late for baby Aisha and her mum." Alice Porter, Sky News.